Yes.
Ouch box.
Okay, is this everybody? All right. So we're gonna start. So what we're talking about today is we're just gonna go through what happens when an animal comes in an emergency, like a collapse episode like yesterday, and how do we all work together as a team, and how does it work best? So the first thing I wanted to say is if something's happening out front, it is always best right now to direct them to this side if possible. And the reason that is that we are more set up for the kinds of things we'll need over here. We have everything over there, and we're going to step over there at the end and show you where everything is. But it's just that more often, like, the anesthetic machine is all set up to go all the time, and so that's helpful as we're doing a resuscitation. So basically what happens when something comes in is the doctor or the technicians are making an assessment as soon as it arrives. And we're going through what's called the ABCs of emergency. So the first thing we do is we're checking the airway to see, like, is there something blocking it? You know, is there phlegm? Is there a ball? Is there a hairball? Something like that. And then if we feel like the airway is a problem, we're going to try to place a tube to put it in the airway. So when a dog or a cat is brought back, it is ideal if you place them here or on the surgery table if one of those spots is free. And if not, you can see that we're all wired for oxygen here, so you can place them actually anywhere. But when we're looking for the airway, we're going to want a tube, and the tubes are actually in this drawer right here. We've got them all arranged by size, and they've got numbers on them. So usually if you just want to make sure, like, if you're involved in the emergency, you can open the drawer and see if somebody needs something. But the other thing to realize is if you're back here, don't just like stand right here in front of the drawer, because that's making it in somebody's way. The second thing is we oftentimes need this little device called a laryngoscope, which basically gives us a light to look at the airway, pushing the tongue out of the way. Most commonly, it's either here, like it's usually set up for a surgery. So it's oftentimes on the little dental tray where everybody's got things set up, or it's up on this shelf in surgery up on top there.
Next to the Pardo.
Next to that monitor. And then every once in a while it's dumped right over here. But if you're standing here and you see it, like making sure that somebody sees that it's there is really helpful, because we're oftentimes dashing around looking for it, and it's a very useful tool at that moment. So then the B of our ABCs is breathing. So once we've got a tube in, if the patient isn't breathing, we start breathing for them. And usually at that point, we're going to hook them to a anesthetic machine, because that's the way we deliver oxygen also here. It's the best way. Even if the animal has already got an airway on its own, we are probably going to deliver oxygen just by putting it in front of its face. But one of the things you can do if you're not involved in that part of things is make sure that the oxygen generator is on. So we actually, around the corner here, when you guys go back in the kennel, you hear that thing chugging away all day long. And that needs to be on for oxygen to be coming out of these machines. So sometimes just going back there, it just has a little simple push button on off switch. But if it's not going back there and turning it on for people while the doctors and the technicians are working on the patient can be really helpful. So most of the time if surgeries are happening, it's going to be on. And then basically we usually need some kind of like tube or bag to administer, like to push the oxygen in, which are all hanging on the wall over here if they're not set up. We usually just use whatever's set up and then switch it out. Yep.
That was my question. Say we have a large dog come in and all we have is the non-rebreather set up. Will we just put them on the
We will
non-rebreather?
start on the non-rebreather as people gather things. So the thing that you look at is in our field, so in humans, there are a lot more like heart attacks where somebody actually dies and it's very easy to like start CPR and, well, not very easy, but it is possible to start CPR and turn them around. In our field, dogs don't get heart attacks very frequently because of just physical things where they don't get the plaque buildup in their arteries. So the most common things we see with collapse are, the thing we can turn around the most is anaphylaxis, which is like I got a vaccine that I reacted to. And usually anaphylaxis happens within the first 15 minutes after a vaccine. So it's like before they've even walked out the door, the animal collapses, its heart stops, and we come and resuscitate it. Also, if they get like a bee sting, they can come in, they can look dead, and we can oftentimes turn that around if it's been a short enough time. So that's the thing that I would say we're most successful at turning around. With a case like yesterday where it's like, we don't know what happened, but the most common guess on a cat like that is that it had it had heart disease, because the most common sign of heart disease in a cat is sudden death. So when you looked at the cat was fat. It was not skinny, so it hasn't been suffering from some chronic disease that the owner never noticed. And it suddenly died. So you're like, what happens with a fat, healthy cat that suddenly dies? It's usually heart disease. Most of the other things, the owner would have noticed something prior to that to kind of give us a clue, like something's not right. So we've gotten through the A, we've gotten through the B, and now we're on the C, which stands for circulation. So that's when we start the cardiac compressions, where we're like squeezing the chest and trying to circulate blood. We also usually at that point will put in an IV catheter and start fluids to try to improve the fluid in the body, because one of the things that happens when you're shocky or starting to pass away is that your blood vessels, you have enough blood in your body to only feed a little bit of it at a time. Like you're feeding, when you eat, you feed your intestines more, and you kind of, you don't stop feeding your kidneys, but you give them a little less for a little while. Like you kind of keep shunting blood to like, where is it most important for my body to have it right now? But if all your vessels dilate at the same time, there is not enough blood to keep circulating. That's what shock is that everything's dilating, and so suddenly your heart's like, I don't have any fluid left, like where did it go? And so that's why we put in an IV catheter and start pouring in fluids to them, because we're like, okay, let's give you enough to move around here, and then we can make sure that everybody's getting something. So for that part, we usually place an IV catheter and then start fluids. And so if you're standing around, usually on surgery days, there's a couple of setups for IV catheters right here. There are supplies in the crash cart, and then there's also like IV catheters down here. But usually there's something lying around that we can grab. And then we usually want a fluid bag. And ideally it's a fresh fluid bag with a line out of it. But I mean, if we just finished a surgery and there's something there that is, in an emergency, it's going to be faster than trying to put one together. But it's also fine to like grab one if one is coming up. One thing to be really careful about if you're grabbing a bag that's already made is to look for, can you grab the little stickers that show, the big orange sticker straight behind you, yeah. So when we add something to a bag of fluids, we put one of these on it. And so every once in a while when we're putting an animal under anesthetic, we will add ketamine into the bag. And so that is not an appropriate bag to grab. So if you see one of these things, don't grab that bag. It'd be better to grab like a sub-Q fluid bag or something, or a bag from there. Likewise, anybody that's cleaning up after surgery, if a bag has that on it, it does not sit up there. It gets discarded. All right. And then let's see. Last thing so we got A, B, C, and now we're at D, which is our drugs. And so at each location we have what we call a little crash cart, which is actually a little like tackle box. And if you want to grab it down, you should, it's helpful if you see an emergency to just sort of pull it closer to wherever anybody is and then just let it sit there so we can open it and grab it. So it basically has an arrangement of the drugs that we would most likely use, and it's got little cheat sheet charts so that we can just say, oh, the dog's about 20 pounds, here's what we're going to be using, so that nobody's having to try to calculate some of these things. And then underneath we usually have the catheter supplies and some like needles and stuff so that everything's right there for whoever's drying it up. So yeah, is a crash cart. So then the other thing that I wanted to talk a lot about was how, so a lot of times I feel like receptionists, the people that work more up front or the vet assistants, like sometimes you're sort of like, what am I supposed to be doing in this? And the thing that is most helpful for us is if you help us with the client communication, because we are in the middle of like boom, 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 making decisions. And usually this is something where the client's really emotional. They have information, but taking us away from this to try to collect that information is really difficult. So it can be really helpful. It's really important for us if you actually do that client interaction where you find out who are they, have we seen the patient before, is the patient on any medications, is there any known problem that might be going on that, you know, might be causing this or might be related to this, and then also providing like support for them. And sometimes this is something where like as soon as you get sort of that first part of things, it's helpful to actually say, just a minute, I'm going to go give the information to the doctors. It's extremely helpful if you pull up the information, like if you pull up the client on Cornerstone so we can actually glance and say, you know, did the owner miss listing a medication for you that might be important for us to know, so that we can look at something, because all of those like seconds that are involved in that kind of thing of like finding it in Cornerstone and figuring out what's going on is distracting all of us from taking care of the patient. But then I usually suggest, you know, as soon as you've got that and given us kind of a brief summary, go back and take care of the client, because the client is usually very emotional. You don't know what's happening. It is not helpful for them to be back here in most cases because, you know, they're very emotional. It's very difficult. But making sure that they know that like everybody's working on it, we're doing the best we can, and hang in there and let's see what's, you know, going on. Just anything you can do to help them out at that point is really important.
Can I add one thing?
Mm-hmm.
For pre-COVID, a lot of times what would happen is clients would walk in with a pet that was in distress and they'd follow you.
Yeah.
When you bring the pet back, they'd try to get back here too, not even thinking about the fact that it's not a good thing for them to be seeing when we're working on their pets. So, I mean, I wasn't here yesterday and I don't know what happened exactly, but just keep that in mind. They will innately try to come back to treatment with you.
Yeah.
So help your coworkers out. If you have the patient and you're trying to get back here, make sure somebody gets that client into a room and doesn't
Right.
come into treatment.
Right. Yeah. Yep.
I have, with getting information from the clients, when I was hanging out at Pets for hours, I saw 2 emergencies come in, and the technician came out and they were super firm with the owner. They said, how much did he eat? When did he throw up? They were really firm, and it was like the owner kind of snapped out of it and just answered those questions, and then like reception came in and cared for them. But
Right.
it was like the technician had to be really firm. It wasn't like, hey, sit down. It was like, how much did he throw up? When did he throw up? What food does he eat? They were super
Yeah.
sharp with it and
Yeah.
like firm. Like I need this information.
Yeah.
From you.
Yeah, and sometimes that can be helpful if receptionists are spelling each other on that. Like if somebody's asking those terse questions, and then somebody else walks in to kind of like, let me talk to you while rub your back while they're giving that information to the doctor. Okay. So my thought was, let's go next door and see. I'm gonna see if you guys remember, and I'm also gonna point out where things are next door. Okay? All right. Does anybody know where tubes are over here? So basically, there's two main areas you're gonna look, and I realized I have to adjust this. That little black box up there is an assortment of tubes.
Let's label that.
I'm actually gonna get it.
Okay, cool.
Yeah, I realized when I saw where they were, it's like, we need a better thing. So I'll get a little bin that'll sit next to the crash box right there. So there's tubes up there. There's a crash box that has the same supplies as next door. So what's the downside is we have no laryngoscope over there. So we can all intubate without one, but it's just a little easier with one. Second thing. Breathing. Okay, so what do we need for breathing?
The anesthetic machine.
Yes, so that's our anesthetic machine. It's an oxygen generator on the bottom, and it's got the tubes and stuff on top. So if you kind of reel it over, that helps.
You want to bring over now?
Nope.
Okay.
No.
Where's your ideal location here then? Right?
Oh, one of
Here
these
or the
tables.
same, the farther one? Okay.
Yeah, I don't care which one, but either one will work. Yeah. Yeah, it doesn't, you can see that we're not piped in for oxygen over here. It all comes from that machine.
Just to clarify, those green hoses coming from the ceiling, those are hooks the oxygen generator,
Yeah.
so everybody knows.
Yeah, they're all runs through the ceiling. Okay, then what's C?
Circulation.
Yeah, and so the catheters are in the crash box over here. We do not routinely put in tons of IV catheters, so they're all gonna be in the crash box. And then the last part. Drugs, and that's in the crash box too. So basically you're grabbing those two things over there, and that over there, and that's it. And then what are the receptionists doing? Yeah. Yep, perfect. All right. Does that help you guys?
Yes.
Yes.
Thank
Okay.
you so much.
Does anybody have questions or anything?
The drugs in the crash part, atropine,
Mhm.
sodium bicarbonate.
Yeah,
I saw lidocaine in there.
yes.
What are we gonna be using lidocaine for? Just local
So,
pain?
you can use it for local pain. You can also use it for certain cardiac problems. So it can cause heart problems and it can clear heart problems. So,
What's the fourth one?
atropine, epinephrine.
Epinephrine.
Yeah, yeah,
Anaphylaxis.
yeah, yeah. So, yep. All right.
Awesome.
Awesome.
Thank you.
Thank you.
Good luck. Hopefully you won't have to use any of this for a while. Since I was blood pressure raising.
Yeah.
when that happened.